Hi, my name is Janet Chesnick, and I'm an LPN and a student nurse. I'm currently working on my RN to BSN from Indiana State University. This video is part of a series of 7 videos that I'm making for my Community Health Nursing 444 class. I also work as a triage nurse for a pediatric primary care office. Each video is going to discuss a different topic that I'm asked about frequently as a pediatric triage nurse. The population at risk that I'm addressing is pediatric patients and their parents. Before I begin, I do want to emphasize that this video is informational, but in no way should replace consulting with your own pediatrician. One of the more common topics that parents ask me about is crying babies. It's important as a parent to know what is normal about baby crying, how to handle it, and when to ask for help. These are the learning objectives for this video. Why do babies cry? My newborn seems to cry all the time. Is that normal? My baby does not normally cry so much, but now they're crying way more than they used to. Is something wrong? My happy baby is now a toddler throwing constant tantrums. What can I do? And what should I do if my baby's crying starts to get to me? Attached to this video is a pre and post test quiz, so you can quiz yourself, as well as a handout with links to find out more. So let's get started. So why do babies cry? From the moment that they are born, babies have found their voice, crying. Crying is their way of communication until they learn to use words effectively. So crying can be an ever-present nuisance for the first few years of a child's life. There are more obvious reasons for crying, like being hungry or in pain, but other times there's no apparent reason. They just want or need to cry. As a parent, that can be very frustrating. I remember crying right along with my firstborn because I couldn't figure out what was wrong. Parents often call my office for this very reason, sometimes in tears themselves, and I feel their pain. So, my newborn seems to cry all the time. Is this normal? Newborns especially cry a lot. This phase can last until they're several months old, but is just that, a phase. Some cry due to colic and excessive gassiness. If you suspect this may be the case, there are some things that you can do. If you're breastfeeding, you can discuss your diet with your provider. There are some foods when eaten by mom that can create more gas in the infant. If you are bottle feeding, you can try stirring the formula instead of shaking the bottle to mix it. That creates fewer gas bubbles. Another option for both breastfed and bottle-fed babies is to lay your baby on their back and gently grab their feet and push their knees up towards their chest. These bicycling motions will help the abdominal muscles push the gas out. Some babies like to cry in the evenings, like they're just letting off steam for apparently no reason. If your child is fed, has a dry diaper, and cannot stop crying, it is okay to lay them in a safe place, like their crib, and step away for a few minutes. Your child needs a sane parent more than anything, so before you lose your cool, step away and cool down. On the handout in the description to this video, there is a link to the website about purple crying. This is something that is taught to newborn parents at my office. Purple crying stands for all the normal experiences of crying newborns. P is for the peak of crying, which is typically around 2 months old, and it wanes between 3 and 5 months. U is for unexpected. You have no idea why they're upset. R is for resist soothing. Nothing works. P is for pain-like face, even though they're not in pain. L is for long-lasting. Some babies can cry for over 5 hours a day. And E is for evening. They may cry more later in the day. Just remember, no matter how frustrating this is, it is all normal and it will not last forever. So, my baby does not normally cry so much, but now they are crying way more than they used to. Is something wrong? If your child is suddenly crying way more than usual, it is best to check with your pediatrician. Things like teething can cause sudden fussiness, but so can illnesses and injuries. For example, some babies with ear infections will cry every time you lay them flat on their back. So, unless your child is obviously cutting teeth, ask your doctor if your child's unusual behavior warrants a visit. If your child's crying is still worrying you, or it's in combination with other symptoms like excessive spit up, possible blood in stool, or fever, definitely call your pediatrician. So, my happy baby is now a toddler that's throwing constant tantrums. What can I do? So, you often hear about the terrible twos, but sometimes the ones and the threes can be challenging. A big part of this is that your child's brain and understanding of language may be outpacing their physical ability to verbally express what they are feeling. The end result is their frustration and temper tantrums. Work with your child on speaking and encourage them to tell you in words when they are upset. If you are worried that your toddler is not on track with his verbal development, consult your pediatrician. So, what should I do if my baby's crying is starting to get to me? As I stated earlier, a child needs a sane parent more than anything. So, if you know your child has all of their needs met and is in a safe place, it is okay to take a few minutes for yourself to cool down. You never want to be in a position where you want to shake the baby to get them to stop crying. So catch yourself before it escalates any further. Shaken baby syndrome can cause lifelong disabilities in children, so please leave your child in a safe place and give yourself some space. In the handout included with this video, there is a link to the Cleveland Clinic site about shaken baby syndrome and its symptoms and treatment. So, what if I have more concerns about my child's health? If you see any of the concerning symptoms discussed in this video, or you have more questions about your child's health, you should consult your pediatrician. As a new parent, you will become accustomed to what is normal for your child. So if you see any changes and you're not sure if it's normal or not, call your doctor. I have attached a handout to this video which has information on purple crying and shaken baby syndrome, as well as just tips for how to soothe your child and things to try. And then, of course, I have the pre and post test quizzes as well. So, as usual, thanks for watching, and I'll see you next time.